Hello, and welcome to the Virginia Department of Health, Injury, and Violence Prevention Program's online educational service. The IVPP team works to prevent injury-related hospitalizations, deaths, and acts of violence by supporting proven and promising evidence-based strategies at the state and local levels, focusing on policy and practice changes at the population health level. This program, Every Ride, Safe Ride, Safe Transportation for Children, a Healthcare Provider Training, is part of the Virginia Department of Health Child Passenger Safety Program and is intended for a broad spectrum of healthcare providers. This presentation is a continuing education activity designed to provide education in occupant protection across the lifespan. Motor vehicle traffic-related injuries have remained a leading cause of death in Virginia over the past decade. However, Virginia continues to make progress in addressing this issue. This success is due largely to the increased proper use of child restraint systems, Child Passenger Safety (CPS) program enhancements, and Virginia's roadway occupant protection laws. One of the most effective strategies to prevent motor vehicle-related injuries and fatalities is the proper use of vehicular restraint devices and child safety seats. However, non-use and misuse continues to impact the safety of children on Virginia roads. According to the Virginia Department of Health's Community Check Station program, 80% of safety seats checked within the program are misused. Not only are parents and caregivers of these children in violation of the law, but children are vulnerable to injury on the road. Healthcare providers are in a unique position to provide effective messaging about proper child passenger safety strategies. The purpose of this presentation is to promote proper safety seat restraint use for children until they grow into the vehicle's internal safety belt system. This training program will run a little over an hour, after which the participant will be able to comprehensively recall national and Virginia child motor vehicle-related injury data, translate long-term public health outcomes of children involved in motor vehicle-related injury, identify newborn, infant, child, and tween physical vulnerabilities for injury from motor vehicle-related crashes, summarize the American Academy of Pediatrics Safe Transportation of Children policy statement, compare and contrast age and condition-specific safety restraint devices, and then translate correct usage, and translate the benefits and barriers of AAP guidelines and Bright Futures Office CPS counseling, articulate the role of the HCP in the primary setting in improving safe transportation of children, and identify VDH CPS free resources for HCP. At the conclusion of this presentation, participants can take the post-presentation exam to earn either continuing medical education units or continuing nursing education units, depending on the participant's certification. The requirements for successful completion of this course includes the completion of the post-test with a passing score of 80% and completion of a course evaluation. This course provides 4 continuing nursing education units. This continuing nursing education presentation was approved by the Virginia Nurses Association, an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation, and is offered at no cost to participants. Any questions about this program should be directed to the Injury and Violence Prevention Program Supervisor at the Virginia Department of Health. To begin the presentation, simply click the Next button.